An implantable defibrillator is a small device that goes underneath the tissue that you can grab, usually under the collarbone, and it's attached to 1, 2, or even 3 leads that go into the heart and monitors for very rapid beats or chaotic beats that cause cardiac arrest, and it shocks them right back, just kind of like a paramedic, and treats life-threatening arrhythmias. The pacemaker sends a small, painless electrical signal to the heart and restores the normal heart rate. And if your own heart doesn't beat, then the pacemaker will beat for you. It's one of the big advances in biomedical engineering to treat cardiac diseases over the last 2-3 decades. One of the big breakthroughs in implantable defibrillator therapy has been that they also can be used to make the heart function a little better. When the heart muscle beats weakly, it beats kind of cattywampus in an irregular fashion, so a third lead can be placed so that the heartbeat is more effective and the symptoms and signs of heart failure can be treated as well. There are some very strict criteria based on clinical trials that you have to meet to qualify for an implantable defibrillator. You have to have sustained a life-threatening arrhythmia problem or had a cardiac arrest or a very rapid heart rate. And it can also be patients who are at risk of having that based on their structural heart disease or family history or some abnormalities in their heart muscle function. The implantation of an implantable defibrillator takes between 1.5 and 3 hours. It seems like a big thing to think about, but it's a small surgical procedure because the incision is not very big, and you're given medication so that you really don't remember it. Sometimes we use anesthesia, and an anesthesiologist helps us with the procedure. After the implantation of an implantable defibrillator, there's a follow-up process. It's just the beginning of a relationship. You're seen in the office in 1 or 2 weeks. And then the remarkable thing is how sophisticated the follow-up information is. We can actually monitor the defibrillators remotely at 3-month intervals, and patients typically will come in at 6-month intervals to review their medications. But if you have an event or someone has some symptoms, they can actually call in and see what's happening on the defibrillator. So the telemetry functions, the ability to monitor people's rhythm, is really extraordinary. This is life-saving technology. It really can save a person's life, and the technology keeps improving. The batteries now last much longer than they used to. Initially, defibrillator batteries lasted 1 to 2 years, and now they last 8 to 10 years. And when the battery is getting low, we can monitor that progress so we know when to replace it. That's an in and out procedure usually where you test the leads, put in a new generator, and the whole battery's in the generator, and often go home the same day. This has been a really exciting area of progress here at Swedish. The first defibrillators were placed around 1985 here, or 88, and we've been a part of all of the progress in defibrillator technology since then. And it's just really a privilege to practice here with the teams that are dedicated to do only this, to work in the electrophysiology lab and offer this state-of-the-art technology.